The ongoing battle against cancer is one of the most serious challenges facing medical science today. Certainly the words "you've got cancer" are among the most devastating anyone can be told by their doctor. But fortunately, extraordinary help is available here in Southern California. And that perhaps best describes the Wilshire Oncology Medical Group. It is a comprehensive cancer care center practice networked in communities throughout Los Angeles, San Bernardino, and Riverside counties, and where they specialize in providing compassionate and progressive care with the latest state-of-the-art treatments, and where pain and suffering by their patients is, in a word, unacceptable. The managing partner of the practice and a highly regarded oncologist in her own right is Dr. Linda Bosserman.
Well, this is a pretty unique medical practice, and the idea is you have these very highly trained academic physicians who come to the community to bring the best of science along with compassion to patients with cancer right in the communities where they live. This group represents many doctors in community oncology, where 85% of Americans are treated in the community, not at academic centers. And as physicians have been able to bring the best of medical care locally, patients can come in for treatment with groups that know them personally. They have a personal relationship with their physician, the nurse practitioners, the physician assistants, the oncology nurses, and we work directly with the patient's primary physicians and all the specialists so they can live their lives beyond having cancer. We have been asked to fully staff the county hospitals in San Bernardino County, which is the largest geographically in California, and now Riverside County, because they've seen our commitment to information technology and electronic record and our ability to demonstrate the most cost-effective care being given to the patients.
My experiences there at Wilshire have been wonderful. I mean, Dr. Gargi is my oncologist. She's very soft-spoken. She's just a joy when she comes into the room. She's very pleasant and makes you feel very comfortable. And the nurses and the staff are just wonderful people too. I actually enjoy going to the treatment rooms for that hour and a half that I'm in there. They make you feel real comfortable. It's almost like, they make you feel like it's part of life. I mean, it's that comfortable.
At Wilshire Oncology, we're dedicated to clinical trials. We actually have 10 doctors. We all participate in clinical trials. I just happen to be the director of clinical trials. So every new cancer patient that presents to any of our offices, including this office at Corona, we screen them for clinical trials. These are innovative therapies that might not be available to patients out there unless it's offered by their doctors. So what I do is, because at any point we do actually over 40 clinical trials in different cancer types, me along with the clinical research team get the right trials for our patients, and then we'll leave it up to our individual doctors who discuss these trials with their own prospective patients. So what a clinical trial means is the patient comes in, signs an informed consent, and then drug X will be given to that patient as part of a clinical trial.
I'm thrilled to participate in this clinical trial because I think it's so important that people are educated and need to be made aware of what research is happening, and that there are clinical trials out there to be utilized if they fit the picture. And it is important that this research is being done because this is all the process of how we make breast cancer and all cancers go away. These clinical trials make a big difference. For me specifically, has never altered my life. I continue to work. I'm very, very busy and very, very fulfilled. Chemotherapy is also very beneficial, but unfortunately, sometimes there are side effects with chemotherapy that will inhibit you from having a level of quality for a period of time. So for that, I'm very, very thankful. And I think that it gives other people an opportunity to be able to continue to be useful as they have treatment versus sometimes being not able to do that because of the side effects of chemo.
We have a case here of a 39-year-old African-American female who presented with stage 4 metastatic breast cancer with a large axillary mass about 8 centimeters at the time of initial presentation. She presented with pulmonary mets as well as bone metastasis, and in actuality she had a thoracic spine cord compression impinging on the spinal cord, but neurologically intact at the time. So we had orthopedic surgery, debulked the tumor, and she had received radiation therapy after stabilization of that area. And she's done quite well. We started her on carbotaxol Herceptin, and pretty much her disease started to regress quite dramatically even on physical exam. And I did some serial CT scans and showed a remarkable response.
Originally, I was diagnosed with breast cancer in 2002, and I had a bilateral mastectomy and was considered cancer-free until last year, when I discovered a lump under my arm and went into the doctor, and they, did all the tests and said that it was actually back and it had spread to my lungs and my ribs. So I started chemotherapy here at Wilshire Oncology, where the treatment is really, really working very well for me. As a matter of fact, Dr. Kim just told me today that my PET scan showed that I didn't have any more cancer in my lungs or my ribs. So I just have it in the central location under the arm.
I'm a radiation oncologist and the physician on staff here. What we do is treat cancer tumors throughout the body, whether it be the brain, prostate, or breast, with radiation beams, and we target that area to kill the cancer at the tumor site. We have top-of-the-line equipment where we can do IMRT, which is intensity modulated radiation therapy, where we can target treating the tumor bed and sort of spare normal tissue, so we don't have to give as much toxicity to the patient during their radiation therapy. Prior to that patient coming to be on the machine, we would have to get imaging done with a CT scan. We would take that CT scan, pull it up here into our computer. We would draw out the tumor volume with the areas that we'd like to target, and I, along with a dosimetrist and a physicist, would technically place the beams, making sure that the tumor was getting the full dose that we wanted to get, and we'd also spare the normal tissues, such as the spinal cord and such things that we do not want to harm, away from those radiation beams. We'd check the plan and then place the patient on the table. The radiation therapist's job is to set the patient up on the table every day, set them up, make sure they're properly aligned, and film them so that we can make sure that they're aligned properly according to the plan that we had made on this computer.
I was, by my primary doctor, was referred to a surgeon, and I went and spoke with him, and he said, before we do anything at all, we want to have you see Dr. Wasserman. And she explained to me what kind of breast cancer I had, what the options were for this type, what my treatment options were, and what she specifically thought would be the best treatment for me, and explained to us, how that would work and what the drugs, a little bit about what the drugs were and things like that.
I went to almost all of the appointments, and I really was impressed with the fact that while we were talking about various side effects or treatments, they took all the information down, and it was very important because in the next appointment we may or may not have met with the same doctor or the same nurse or nurse practitioner. They had our information at their fingertips. It was essential. We weren't repeating ourselves. We always had up-to-date information, and we got the best care for that reason.
And for me, or for both of us actually, that was really wonderful because my biggest thing was I just didn't quite know what was going to happen, and it was scary not knowing that. I think they were really honest about what I could expect, even the downsides. Just went straight ahead with the treatment and didn't really have any big problems. It was for me that really helped, just knowing exactly what to expect.
They really set our expectations well, and then they lived up to them, and they were very personable throughout that whole process.
Mm-hmm. Anything we can do to help our patients prevent cancer, cure their cancer, and live beyond their cancer, that's what we're here for. I think I'm one of the luckiest people in the world to be able to have a career that brings the best of my interest in science with real people that we can touch every day. My own family is treated through the clinics at Wilshire Oncology. Our colleagues are treated here, and we've been able to set a tone that it could be any one of us tomorrow, and how would you want to be treated? That's how we try to bring the care to our patients.
And there you are, a unique inside look at the Wilshire Oncology Medical Group, specializing in not only compassionate, but also very progressive treatment for its patients. I'm Doug Llewellyn reporting from Corona, California.
Well, that does it for this edition of Close Up on America's Business. I'm Janice Marie. Thanks for joining us. We'll see you next time.